Hi, I'm Rajan Gupta. I'm a professor of radiology and urology at Duke University in Durham, North Carolina. I've been in the field for about 15 years and have seen an enormous amount of change that's happened over the course of time. So I think abdominal imaging is a really unique space because the information that we provide to our clinicians is so incredibly important for their treatment plans and assessing their patients' responses to therapy. And one of the things that we think about in abdominal imaging is how do we best get the information to our clinicians that is most actionable. There's a ton of advances coming through abdominal imaging right now. I'm excited to be part of that journey and excited to see how we can translate those things to our patients. So as a radiologist, there's been a lot of hype talking about artificial intelligence and its impact on the field. For me, I think of that feeling as excitement. I think that artificial intelligence has the ability to improve my quality of life and my quality of work by taking out some of the mundane tasks that I do on a daily basis and automating them. I'm not nervous about the worries of artificial intelligence taking over. What I'm actually really excited about is the ability for me to do more of what I enjoy doing and more of what allows me to help my patients and my clinicians via the use of thoughtful artificial intelligence solutions. There's a lot of buzz surrounding it, and understanding what's going to come is something that we'll have to see and shape, because with all the technology that's out there right now, we need to understand how we can best utilize it. As radiologists, sometimes there's a feeling that we're insulated from the patients, and we don't think of it that way. We think very much that every single encounter that we have with a patient is at that workstation, if you will. But we also have interaction with patients directly in the form of doing procedures and therapies, etc. I think the idea of putting the patient at the very center of the care continuum is really important. And I think that the way we do that is start thinking about what information do we need to provide as radiologists to them so that they can get the best treatment plan for them. I think also making it more convenient for patients and making it more accessible for them to get next generation information or cutting edge information on their care. It's not just about the size of the tumor, it's now also about the idea of what are the characteristics of that tumor and how can we personalize the therapies to that individual. So radiology is getting more global, but it also needs to get a lot more personal as well. So I think that radiomics is a word that gets tossed around a lot, and it's a word that some people really understand and some people need to better understand, but I think as a field we need to embrace it. The way I think of radiomics is that it's the ability to find more things inside of tumors that are not necessarily palpable or visual to the eye. So right now as a radiologist, I look at the presence and absence of a lesion and I look at the size of a lesion. Radiomics will hopefully allow me to look even deeper into that patient and see what are the characteristics of that. What type of features inside of it will allow me to know what treatment might be best for that patient? How do I best tailor the information I'm providing to my clinicians so therefore they can tailor the treatment for that patient? So I think that what radiomics allows us to do is to better personalize the care for these patients by getting more information out of images than we've ever been able to get before. So I think as a radiologist, I think that there's a couple of ways to look at your role. We like to look at our patients as a group of people who are coming to us for help, and we need to provide them help in every aspect that they could have. And so when you think about it in that sense, you all of a sudden become a specialist inside of a disease process, as opposed to just a radiologist that's working in isolation. So interdisciplinary collaborations are actually what I think is going to push the field further than anything else, because that is what is going to allow people to get truly harmonized care that is most emblematic of the kind of advances in medicine that are there today. But as we start thinking about going deeper beyond the initial ability for us to look at the image, we start talking about imaging biomarkers. What are the different phenotypes that might happen of a cancer that will allow us to create a treatment plan that is customized to that individual patient? There is so much information inside of medical data, medical imaging data, that is just untouched right now. And the ability to uncover some more of that stuff is, I think, what's going to take us forward. Because so much of abdominal imaging is focused on oncology, that's why I think that radiomics is going to play such a crucial role in the continued development and advancement of the field of abdominal imaging in years to come. So one of the things that really strikes me about radiology is how fast it's changed. I entered the field at a time where prostate MR was somewhere in its infancy, not really fully utilized. The techniques around CT were certainly advanced, but they've become even more advanced. And I think that one of the things that really excites me about radiomics and artificial intelligence in medical imaging is that it's that next evolution of where medical imaging needs to go. And so for me to be part of that, I find that it's an amazing feeling to be part of a field where you may be an expert in something that you never trained in residency. But it's a new way of learning, it's a new way of embracing technology, and it's a new way of thinking. How can we best utilize the tools that are out there to impact the lives of our patients? And so for me, the field is incredibly exciting because of that continued evolution of thought and that continued evolution of how we better utilize technology to impact the downstream effect on patients.